Begin.
Hello, my name is Dr. Hamid and I'm one of the junior doctors in this hospital. And may I know your name?
I'm Mrs. Diane.
And how old are you?
I'm 47, doctor.
Okay, so Mrs. Jane, you are here for some concern. Can you tell me more?
Yes, doctor. I have some kind of swelling on my breast. So I'm a bit concerned about it.
Okay, when did you notice the swelling?
I noticed it a few days back.
Okay. And there is any other symptom? Any
Like what, doctor?
any discharge?
No.
Or any fever?
No.
Have you noticed any weight loss?
No.
Okay. Is there any family history of breast malignancy or anything?
Nothing like that, doctor.
Okay. Well, I really appreciate if you are here. I need to examine, and for that I need a lot of exposures about the baselines. I will make sure your privacy, and I will also provide the checkpoint so you will feel comfortable. Okay?
Yes.
Can I proceed?
Yes, please.
Which breast do you have?
Right.
I will need to touch you. If you have any pain, just let me know, okay?
Sure.
I would also like to examine your lymph nodes. Okay. Okay. You can cover yourself now.
Thank you.
Okay, examine your breast. You have a lump. The lump is regular. The borders are regular, and there is no discharge, and there is no redness or no warmth and nothing like that. Okay. So for such kind of what do you suspect this could be?
I don't have any idea, doctor. Could that be cancer?
Well, based on my assessments, I don't. We don't know really, but we have to do more investigation to rule it out. But there are these possibility of cancer, as you don't have any weight loss, and there is no alarming feature in that. Okay, but there are no possible lymph nodes. Okay.
Okay, that's quite reassuring.
So I will order some investigations, a mammogram. I will refer you to the radiology department, and then when the results come back, we will let you know that what's in there. Okay. I would also take your blood samples to look for any inflammatory markers if you have any infection. So we are aware of that.
Sure.
Do you have any concern?
Nothing, doctor.
You want to know anything about it?
No. So I'm 47 years old. So am I okay to do the mammogram?
Yes, you can do it. And this could be used as a screening tool. We can arrange it again for you after 2 years,
Okay.
every 2 years.
Mm-hmm.
And how about your other screening? Are you up to date with the PLAB smears?
Yes, doctor.
How are the results of that?
It says normal.
Anything you know about it?
Any questions?
Any question you know?
No.
Okay, I will also provide you in detail copy about any lump in the breast, what could be the results of that, and I will also provide in written form.
2 minutes remaining.
And anytime if you need help, you can contact us.
Definitely.
Are we done?
Yes.
So, what did he miss?
So Isha said, I saw the video. There are certain positions that you're supposed to do while examining the breath. Before that, the consent and everything is missed. Jacqueline caution is.
Okay, so previous knowledge, understanding, experience, did you have it done before? Okay. Then prerequisites, right patient, right side, okay? Which side is the lump? So you need to find out, okay? Rather than you ask in the middle, whether this, whether this is right or wrong, okay? Right or left side. So you need to ask it in advance, okay? In the prerequisites before you start. That's a prerequisite.
So the 5 Ps that applies on examination stations as well, no?
Yes. Yeah.
Examination
Yeah. Any procedure, examination or the procedure.
or teaching.
Even teaching. Okay. So, what position you want the patient to be in? You explain the right explanation of the procedure. Okay. Right exposure. What sort of exposure you need? You need to explain that. Okay. Just in few words, just a couple of sentences. Then, first of all, take the focus history. When did you notice it? Is it on one side, both sides? Is it the first time? Is it painful? Is it getting bigger? Do you smoke? Do you smoke? Any history of singular lumps in the family? Okay.
Move on to the next station.
And then you move forward. Explain that I need to examine to get more information. I need to examine you quickly. And for the purpose, when you explain any procedure, there are two headings that you need to. Explanation, there are two subheadings actually that you need to go through. During, for the sake of this examination and during this examination, I have very brief notes on taking history and approach, those things. They're available on the Facebook group. If you go to the files, you can download it. Okay. So there are just some approaches and stuff.
So for the sake of this examination and what was the next?
Yeah. So for the sake of this examination and during this examination, so you need to cover both of them, as we cover 5 Ps for everything. For the explanation of any procedure, you need to cover those headings. For the sake of this examination, I need you to be sitting and I need you to be bare above your waist, okay? And during this examination, what you will be doing, just tell that briefly. During this examination, I'll be looking, feeling, and I may be asking you to do a few maneuvers for me, okay? If at any point you feel discomfort, if you feel any pain, let me know. Then is the third P, then we are entering the third P. Third P is a precaution. I will make sure that the chaperone is present, okay? And I will ensure the privacy as well. Does it make sense? Then you start the procedure, okay? So there are 5 positions. The fourth P is the procedure itself, okay? So inspection and palpation, it has 2 parts only, inspection and palpation. Inspection in 5 different positions, palpation in 2 different ways, okay? Inspection while sitting upright with hands on thighs. Inspection while the patient is bent forward with hands on thighs. Inspection while the patient is still bent, hands on the hips, okay? Inspection when the patient sits up again, ask them to lift their breast up, and again inspection with the hands behind the back. Okay, so these are 5 different positions for inspection. There are 2 different ways of palpation. One is the superficial, or 2 different parts of palpation. You can say it should be at line 45 degrees. Okay, you must watch the video. I have very good video of it. So 5 different positions for inspection. 2 different parts of palpation, superficial palpation and deep. Ideally, we should start from the normal side or the good side. Okay, And we need to compare both of them, both the breast. Okay, and what we are looking for, now talking about them individually, inspection, palpation. In the inspection, we start by asking the patient to sit upright, okay, and with the hands on thighs, say for example, this is a patient sitting upright, okay. What we are going to look for, any change in the color, any visible lump, any dimple, okay, any skin tendering, okay. You start from the peripheries, go towards the middle, okay. When you start palpating, you come reverse, okay. You start the palpation from the middle, from the nipples, and come outwards. Does it make sense? Okay. Now, you're going to start commenting on that. Can you see any lump, any signs of infection or inflammation, like the redness or anything? Okay. Then you come towards the nipple, mention about if you can see any dimple appearing, any skin tethering. Then towards the nipple, can you see any mass underneath in the periareolar region? Okay. Then in the nipple, can you see any discharge, any crack, any bleeding? Okay, and also any change in the texture, not only the color. Okay, here you can see this is very good Mannikin. So here you can see the change in the texture. Yeah, this is an orange peel of the pod orange. Okay, pod orange.
And nipple is at the same level.
Yeah, so both breasts appear symmetrical and both nipples are at the same level. Okay, so this is the first position. You have done the main inspection. Now you ask patient to bend forward. Okay, at 45 degrees approximately. You do not need to mention about the degrees. You simply ask them bend forward. Okay, now the patient is bent forward.
Still has
No, that's a third thing. Okay, so patient.
just with the
This is the first position. Give me the chair.
dentist.
Okay. First position while the patient is sitting. Second position while the patient is bent. Third position while the patient is still bent. Hands on here. Okay. The fourth position is ask them to lift their breast up. Okay. And the fifth and the final position is ask them to take their hands behind the neck and lie down. And we do the inspection at 45 degrees and we carry on the palpation in that same position. Okay? Does it make sense?
Yes.
Guys, any question? Online team? Hello? No question?
Yes, yes.
Okay. You can raise a hand if you have any question, okay? So we are done with the 5 positions. Next is the 2 different parts of palpation. As I mentioned, we start the palpation from the middle and move on from it. Okay? In the 4th position, when the patient is sitting up, okay, you ask the patient to lift their breast up and squeeze their nipple. Okay, what you are looking for, if there's any discharge, any bleeding, any crack, anything. Okay. Now the patient is lying. You come closer and have a look again. Okay. The 5th
When
position.
the patient bends forward, what
Yeah.
are we looking for? Any
Any
fullness? or-
no any tethering, Okay. So what happens when? What is the significance of those positions? Now, when the patient bends forward, if you see any dimple, say for example, on this, either you listen me, you want to carry on teaching, I'm happy for that. Honestly, I will rest. Okay? I will really enjoy. When you are bending forward, when the patient is bending forward, you might see some dimple. It means that there is a lesion which is adherent not only to the underlying structure but also to the skin, okay, to the overlying structure as well, okay, because it will stay there because of pores, formation, the adhesions.
So if there is swelling, there is a swelling,
Yeah.
do you have to say that when the patient bends forward, I can see the skin is,
Well,
there's a dimple.
There may not be any visible swelling in this position. Okay? But when the patient bends forward, you see the dimple. Okay? It means that there is something that you cannot see, but there is something hidden. Okay? Now, when the patient bends forward and you ask them to press their against their hips, okay, what happens? It causes a contraction of muscle, pectoralis major muscle, okay, and the dimple becomes more obvious, okay. Or if there was no dimple in the beginning, it may cause a dimple. So you mentioned that it seems that it is attached to the pectoralis major muscle, or it is attached to the underlying structures, okay. So the dimple became more obvious on pressing against the hips. Possibly there's the lesion is attached to the underlying structure. Okay. Now the fourth position, lift it up, squeeze your nipples. When they lift it up, look underneath. If there's any fungal infection, any ulcer, anything. Okay.
But we will ask the patient to lift it up.
Yes, yes.
But in real examination, are we going to do that? No, just ask.
No, you ask the patient. Yeah, you can mention that. Ideally, I will look underneath. Okay, where you are finding any limitation, where you see that you cannot do. Okay, but this is something that you had to do it. Use the word ideally. I will do this.
And if there is any intertrigo, okay,
Hmm.
and if there is any intertrigo,
Intertrigo.
then when I'm asking the patient, can you lift your breast up, and I need to see the inframammary region.
Hmm.
So
Yeah, you can ask. I do not think that they are going to make it so
we will
difficult.
give you a
things, okay.
photo for that.
Okay. Now, going back to the lying position, the palpation. Okay, so we're going to start. Say, for example, this patient is lying at 45 degrees. No, it's okay. It's okay. We'll find some permanent solution. Okay.
Sir, जब हम inspect कर रहे हैं, we're doing palpation at
Now
the
we are
same
talking
time.
in English. This
No,
section
no.
is purely in English.
So sorry. So when we are doing the inspection, we have to do the palpation as well at the same time, or like when we're doing the first position, then just inspection. Or
Just inspection in 5 different positions, then is the palpation. Okay. Yeah. So palpation continues where your inspection finishes. Okay. Your inspection finishes at 45 degrees. Okay. Here you come and look around again. Okay. From here you will carry on the palpation. Palpation should be done in 2 different ways. Okay. Superficial and deep. Okay. And both the breasts should be compared at the same time. Not palpation superficial and deep on one, then you go for the next one. Okay. So during the palpation, at all times, make sure that intermittently you keep asking the patient about the comfort, about the pain, and also cast an eye on the patient's face. Okay, so the superficial palpation, you do this, okay, yes, and coming outward towards the axillary tail. It finishes, palpation ends in the axillary tail. I've done the superficial on here, and again I will do the same on here.
So the normal side should be the
Ideally, we should start the normal side, but there is no exception for the breast. Okay, you need to do both of them. Okay.
and temperature.
Yeah, we should ideally start by checking the temperature. Okay. Check the temperature. Okay. Then
It's
superficial
like here and
palpation.
here.
Yeah. Superficial palpation. Then the deep palpation. For the deep palpation, you need to use 2 hands in particular. Okay. For the superficial, you can use 1 hand, but for the deep, you need to use 2 hands. Okay, one to stabilize the breast mass, otherwise it may move. Okay, and then you are going to do that deeply. Another important thing that you need to mention in this patient is that during this examination, my hands may touch your nipples. Okay, I will try not to do that. Okay, but however, if that happens, I really apologize in advance. Okay? And be careful. This is multinational LGBT, multiple things happening. There is no exception if this is an intimate examination. females can blame the females.
Yeah.
Okay?
Yeah.
So it's not about the gender. Okay?
Sometimes the simulators will say that I'm feeling awkward or I'm feeling
If you are awkward, then they will say,
uncomfortable. So how do we respond? to that?
apology, I'm sorry.
But I have to continue or
Would you mind if I continue?
okay.
I'm sorry.
Uh,
You do not have to. It's their choice.
no,
Their
because
expectation.
they do say it sometimes.
No,
and
what I'm saying is, it's their choice, okay? Ask them, would you mind if I continue?
okay.
Be careful. I'm sorry if that happens. That happened. Okay, now use two hands. Again, coming outwards in circular fashion, you're going to stop here. Coming outward in circular fashion, you're going to stop here. Okay? So, now this should be proper deep. Okay? And here you can feel something. This is, okay? We should start from the perioral. Listen.
Start from here
Yeah, start from here. Okay?
and
Then move outwards, going away towards exhibit. Okay?
so this fixing on one side, can it be anywhere?
Yeah,
Here,
yeah. So
here,
against
anywhere, to stabilize.
against the movement.
Okay.
Okay, if you're pressing from here,
Mhm.
you need to stabilize there. If you're pressing from there, stabilize. Just careful. Okay. So like this. Continue moving, coming outwards. Okay, and then you finish the exhibit. Then at the end mention that ideally I will examine the axillary lymph nodes in the supraclavicular fossa. Okay? So this is how we do it. Now, if your patient allows or if your time allows, there is a technique how to use, how to do the lymph node examination. Okay? So you ask the patient to put their arm on your arm, okay? So then you perform it. Okay? Say, would you mind putting your hand? I'm going to feel into your armpit, okay? It may be a bit ticklish, I'm sorry about that, okay? Yeah, let me know if it is discomfortable. Medial, lateral, anterior, posterior, and apical. Okay? We're going to do the same on the other side, okay? Thank you. Medial, lateral, anterior, posterior, thank you. And let me feel your neck. Okay? Thank you. Now you can come yourself. That's all. Okay?
In this, is that dimpling? This is
No.
dimpling.
No.
Okay. Supposing we did notice dimpling, how do we describe that?
So you can you can mention, you can use this name. I can see.
Observe.
Yeah, I can observe, or I can see there is a little dimple in the right upper outer or right lower outer quadrant. Okay, so you need to describe in that in the form of quadrants.
Right.
Now, another very important thing about this is wherever you see the lump, wherever you feel the lump, okay, do not stop there. Okay, say for example, this lady has a few lumps. Okay, so you continue examining. Okay, till you locate all the lump. Okay. Then you need to perform the examination of the lump. Examination of the lump is different from the examination of the breast. Does that make sense? Okay. So you need to describe and characterize a lump separately: size, shape, fluctuation, transillumination, adherence, attachment. Okay.
So you said that sometimes they say it's making me uncomfortable. So do we have to explore what exactly is making you uncomfortable, or no? I
No.
just apologize.
No, apologize. What is making them making uncomfortable?
What can I do differently? Like, do I have to tell that? Would you have explored that, or we just have to say, I'm sorry, you know, would you like me to continue on?
It depends. I'm not much bothered about that. apology the patient, be careful in general. Okay. Why you won't waste your time in asking, okay, what happened? Okay, then you start explaining, I'm sorry, I never meant that. Okay. I think I will simply apologize and be just ask them.
Would you mind if I continue?
Yeah, would you mind if I continue? I'll be more careful.
So can we do examination of the perineum with the thumb?
Yes,
Yes.
as you feel. Okay, but it depends. So this nipple is retracted. Okay. Yeah, there is a big lump which is attached to the underlying structure. Okay. You can feel this is very thick skin. Okay, powder orange. There is also at the bottom there is thick skin. Okay.
And for superficial also we examine the perioda.
Well, yes. Okay.
So it's like.
And there are several lumps in this. Okay. One here, then there are lumps in the axilla as well, I think. Yeah.
So how do we say like if there are multiple lumps,
Okay.
I can find that there are multiple.
So you say that I examined my patient's both breast and I could find out, I could feel that there are multiple lumps. Okay. Of different sizes. I exactly don't know about the size. I could not figure out. The biggest one or one I examined feels very hard, irregular, and non-inherent. It is non-fluctuant, and I would further investigate it.
So fluctuation is like how we have to fix one side.
Yeah, no, you need to just take between the fingers. With the fluctuation.
So it's also not fluctuating.
No, these are the hard lumps.
Yeah.
Okay.
And if we don't say the exact like whether it's fluctuant or
No, it's
backdate,
okay.
then
Yeah, it's okay. You're still going to investigate further. Okay. Now going to the management. Okay. It is important. You said that is any malignancy in the family. Okay. That's very wrong. You shouldn't say that. You initially ask the patient, is any malignancy in the family? Any history malignancy in the family? Okay. Or record it if you don't agree.
I have said that.
Yeah. Okay. So this is a triple assessment. Okay. This patient needs a triple assessment. Triple assessment by
Radiology.
examination and history and examination. That's the first assessment. Okay. Second is the investigations. Third is the tissue biopsy. However, you are not going to name it. Okay. Now we know that you have a lot of knowledge. Okay.
Then how to ask the family history? Is there any breast or own condition in your family like that?
cancer.
Any similar
Cancer
problem?
history.
Yeah.
Any similar lumps?
Any lumps and bumps? Any history of lumps and bumps in the family?
So
There
is
no
it the
problem.
word malignancy?
It's a malignancy. It's a malignancy may not make any sense.
Cancer.
for the patient.
Cancer.
Yes.
Directly about
Oh,
breast.
better you ask any similar problem in the family or any lumps and any history of lumps and bumps in the family. Okay. Now, triple assessment. Okay. You will refer the patient to the breast clinic.
Breast clinic.
Okay. So mention that I can feel that there are.
It's already she's there in the breast surgery.
Breast surgery. So in that case, what you can do is you can okay. So I will request X-rays and discuss with the team. Okay, and depending upon what we find, we will make another appointment with you. Okay. In the meantime, I will do a few blood tests as well, and you could go home if you start feeling unwell, if you develop any worsening symptoms, anything that is not that bothers you, please give us a call. If you become unwell, call 999.
Shouldn't we inform about the mammogram? Just scan mammogram.
Well, give them the opportunity to ask. Okay.
Okay.
Give them the opportunity. If you keep telling everything, then you take the charge. Okay. So do you have any question? Okay. There are a few things that I'm thinking of. One of them is to do the X-rays of your breast, okay, to find out exactly a bit more about the nature. We will need to do a few more blood tests as well, okay, to make sure that we are not missing anything. And after all the information is in place, we will discuss your case. Okay. I will also not make you sing this note, make sure that you are seen on time, and we discuss your case. If there's anything, please contact us.
So,
Okay.
but for this patient, we will do mammogram. Like, is there any age above 45 years or something like that for mammogram?
Yeah.
Ultrasound is like less than
Yeah.
40.
Is it 40 or 35?
NHS says 40.
40.
Okay.
Above 40.
Above 40,
Above 40 mammogram.
Mammogram.
And below
below
40
is
because the breast tissue is too dense, that's why we do ultrasonography.
And in both cases, we will do X-ray as well.
Mammogram is
X-ray.
X-rays. Mammogram is X-ray. Okay. So mammogram
Breast
is
X-ray.
X-ray. We do X-ray because the calcification increases at after 40. Okay, the tissue density becomes less. Okay. Before that, it is more soft, it's more fat. Okay, and that's why on the X-rays, even if you do them, it's not because we do not want to expose the patient to the radiation, because those X-rays are useless. They do not tell us anything. But after that, the patients start developing. First of all, there is loss of fat tissue. The breast become more more the muscular stuff. Okay, or the breast parenchyma, and also the patients can develop microcalcifications, okay, which becomes more obvious. The formation of the microcalcification is more common in the malignant tissues, okay. So you will see that the X-rays are more obvious on after 40, okay. So that is the
If
reason.
the patient asks what is ultrasonography, can we say in a single sentence
Yes.
like video scan,
Jelly scan,
jelly scan?
jelly scan. Okay, guys, any question? Raise your hand, please.
So, do we do the biopsy over here?
That is the next stage. Do not talk about the biopsy, okay? If the patient asks you, okay, well, what are the next steps? Okay, you can use an umbrella kind of discussion. You can say, that's a good question. I can see that you're concerned. Okay, I cannot tell you in particular what will happen in your case because we still need to discuss. However, in few instances when the patients come with a singular lumps in the breast, okay, sometimes we may need to take a small piece of the lump to see underneath. I cannot say what will happen in your case, okay, but do not break this discussion before the patient asks. Okay. Do not tell them.
Even if we find a lot of lumps and
Yes,
we
yes,
suspect
yes.
cancer, we are not going to say it's cancer.
Without confirming.
Yeah. Like,
Even if it is cancer, mention that. Now, the patient asked you, doctor, when you check eyes, ideally you would have checked before, okay? So, I'm worried about cancer. Why did you not think appropriate in asking why are you worried about? Why you think it is a cancer? So, explore that. Okay, so these are the time when you can build your good rapport on IPS. Okay, so why do you think, Samantha or Mrs. Dean, why do you think it is cancer? Okay, and maybe the time that you miss something and the patient say because one of my friend had, my sister had similar problem and she was found to have cancer. Okay.
What did you say about FNAC P size?
Who said?
No, like I cannot say before discussing a senior, but sometimes when patient comes with similar symptoms, we do what? types. You have to
Bigger
say that
tissue.
types.
Take
Oh.
piece.
Piece, small piece. Okay, it's a small piece of tissue. Okay.
Piece. Okay.
Yeah, PIECE.
Sir, even if there is a positive like family history, weight loss, and that, still we don't have to say it is breast cancer.
Do not say. Do not say. Okay. Yeah. Do not say.
The-
But you can still talk about your suspicions. Okay. Of course, this is going to be the cancer. Okay. You can say I suspect or I feel it is something serious, something sinister. It is possibly a cancer. However, I'm not sure 100%. Okay. But you need to wrap it up with some
Sugar
Reassurance, yeah.
reassurance
I can
or
imagine
some. Yeah.
you have a lot of plenty of questions in your mind now.
Okay.
But
Then,
I can tell you
yeah,
what.
there are many things going on. Okay, but don't worry about that. We are here to look after you. Okay, and this is a time when you can involve the patient, give some more sympathy, empathy. Okay, I can see that you're much worried. Okay? Let me reassure you. You are in the right place. You are in the safe place. You are in the right hands, safe hands. Okay. Leave everything with me. Okay, do not worry. Now you have told me, leave it with me. Okay, I'll make sure that I go and discuss. I'll make sure I do your X-rays. I'll make sure I do all the blood tests and nothing is missing, so that we discuss your case.
Now do we say we will refer? No, we are at this.
No, this
Surgery
this is already the breast
I
surgery.
will consult with my
Okay.
seniors and
Yeah. Here you can say you are already in the right place. Okay. If we are sitting with GP, there also you can say, however, you can say, I will refer you to a better place where they have all the facilities. Okay. Yeah, they have all the facilities and you will not need to worry about anything. I make sure that they see you on time. Okay. And in the meantime, if there's anything else I can do for you, okay. I'm just a phone call away, so you can say so many things. There was a survey last week. There was a report published that the females they are the best empathizers. Yeah, that was advertised actually by the GMC. I think. Yeah,
bad.
published by the GMC or BNA, any of them. One of them.
So once she PLAB to examine.
Huh?
I mean, once she does student of PLAB to.
Who? It was a survey, it was outcome of the survey that the females are good empathizers. Yeah.